Welcome to our fantastic new space. You are at the brand new, we've been here about 2 months, the new Advocate Dental Center. We are now at 913 West Wellington, which is exactly 1 block west of our previous facility, which is at 811. And as many of you may know, this was quite a long process. It took several years to complete fundraising for the project, another year of planning, and then almost a year to build out the space. But now that we're in this new space, we're realizing all the advantages that this new space offers us in terms of increased capacity to treat our cohorts of underserved patients. So this morning, I'm pleased that I'm going to be able to kind of take you on a little video tour here through the new space and hope that all of you might have an opportunity at some point to visit us. When we sat and designed the new space, we've got 2 quite different practices that we had to design the space for. One would be more of our fee-for-service, our more, say, normal general dental, pediatric type practices. So we're going to start in that space first. And the first thing that you'll notice as we move into this portion of the space is that we have these fantastic, almost floor-to-ceiling windows, quite different than our old space. Our old space was like being in a submarine. So this space is open and airy and a lot of light. So again, this would kind of replicate a high-end Lakeview type practice. So Ellen's going to kind of scan into a typical operatory. So there are 6 full operatories for general and pediatric dentistry in this portion of space. Ellen is kind of panning towards the 2 hygiene operatories. So there are 2 hygiene operatories dedicated specifically for hygiene activity. So this portion of the space, there are then 6 full operatories as well as then these 2 hygiene operatories for a total of 8. The first operatory, essentially back in the OR portion of the space, is the special needs room. This is the dedicated room for treating special needs patients. Again, a very oversized operatory that will accommodate wheelchairs and multiple people staff that often requires to treat these patients. There are 2 of these oral surgery suites. So these were built out specifically to be able to manage more complex oral surgical procedures. We have a very large staff of oral and maxillofacial surgeons who practice here and admit patients to the hospital for procedures. So these rooms are very generously accommodate their activity. The next rooms, there are 3 essentially mini OR suites. So these replicate what an OR suite would be up in the operating room. There are anesthesia machines, drug carts, anesthesia supply, and then all of the dental equipment at the back end of the operatory. So these rooms are used for anesthetic cases for special needs in pediatric patients. So this portion of the build out is really one of the jewels of the build out. It's a 3-bay recovery area. And again, we didn't have anything like this, anything close to this in the previous facility. So patients who are going to be sedated come back to be pre-opt back in this area, brought into the anesthesia rooms or the OMFS procedure rooms. Cases are completed. Phase 1 of recovery, so initial recovery is done then in the anesthesia room. Patients come back out here to complete their recovery in the recovery area, and then they are dismissed to home through the back door here. And we're going to view some of the amenities that we didn't have in the previous facility as it relates to staff and residents as well. So Ellen's going to pan into the staff/team lounge. So very nice room with refrigerator, microwave, sink for our staff to take breaks and enjoy lunch. And then this is the spacious resident room. And again, they were kind of crammed into a little closet in the previous facility, and down here they have a very, very generous room. In fact, it's so nice that I have to kick them out at the end of the day. So Ellen is now videoing the plaquing recognition of all of Dr. Harvey Wigdor's contributions to the residency program and to the department in his 16-year tenure as chair of the department. This area was built out specifically for our 3D CBCT, which is a scanner. So we use this frequently. Our oral surgeons use this to take 3D scans of our patients for reasons of diagnosing pathologies. We use this for implant planning, for surgical procedures. So this machine we did have, but it was in a very, very cramped space in the previous facility. Here, it's now also wheelchair accessible. So with that, that's just about the end of our tour, and I think everybody can appreciate what a great, fantastic new facility this is, and already we're reaping the benefits in terms of running our sedation cases, our anesthesia cases a lot more efficiently, being able to see a higher volume of patients in a much safer environment as well. And we're getting a lot of positive comments from our patients, certainly from our attendings and staff. So I want to thank Masonic Family Health Foundation for their generous support in building this out, helping fund and build out the space. And we promise you all that we're going to use it and be able to treat our patients at a much higher level of care. So thank you again. Thanks to all.